now present For the Record.
Welcome to For the Record. I'm Naomi Holmes. In 2021, an unparalleled staffing crisis in Wisconsin hospitals that show few signs of relenting. That's according to a new report out from the Wisconsin Hospital Association this week. Across the state, hospitals were pressured on all sides by the demands of delayed care and surges in COVID hospitalizations. All of this while staff retired or left in record numbers thanks to the combined tensions of an aging workforce and population and the Great Resignation. Now I am joined by Ann Zenk from the Wisconsin Hospital Association and Kyle Nondorf, president of SSM Health's St. Mary's Hospital in Madison. Thank you both for joining me.
Glad to be here.
Thank you.
And I want to start with you. There were concerns about Wisconsin's healthcare staffing before the pandemic. Wisconsin for a long time has not been just overflowing with hospital staffing, but nothing quite like this. Where are the gaps and what changed last year?
You know, I think in 2020, vacancy rates stayed pretty stable. Between 2020 and 2021, though, we saw drastic increases in vacancy rates. Another trend that we have been aware of, but that also really was established in 2020 and 2021, is that the highest vacancy rates across the board are in entry level or those frontline technical positions that hospitals need.
Which, Kyle, I mean, you're president of the local, one of the major hospitals here in Madison. Where are those gaps really being felt most on the ground?
It's kind of similar to what we're seeing nationally, too. It's a little bit across the board. We're seeing it certainly in nursing and some of the higher trained to skilled positions, but we're also seeing on entry-level positions as well. So we're really trying to fill those voids, but we are seeing it just like much of the nation is across the board. So,
can you give me examples of places where perhaps patients aren't necessarily directly feeling the shortage, right? But are there services you're having to go without, anywhere where those gaps are most keenly felt?
Well, it's been remarkable. We've had many of our team members who step up and are working extra shifts and picking up extra. But, you know, you see it all the way from food and nutrition services, environmental services, certified nurse assistants. We're also seeing it. But really, we've been supported by a remarkable team that are picking up extra shifts, but they're getting burned out. And that's causing some of this resignation as well, as people are just really tired after 2 years of picking up extra shifts to try to help fill those voids. But you see it really in multiple areas right now in multiple healthcare systems.
It's been a long 2 years for everyone in healthcare for sure. One of the things that I think has it's been in media coverage, right? But it's really not been the overarching story when we talk about staffing shortages. And your report really didn't mince any words when it talked about the nursing home shortage, which really contributed to this, right? So when you can't move patients out of hospital beds into nursing homes, you're dealing with a lot of backup, and that really was a factor mentioned in this report. Could that have been avoided?
I think that, you know, COVID helped highlight some of the issues we've been aware of for a while, in that we really have to make sure that patients and community members have access to care across the continuum. So the backlogs that hospitals experience, you know, patients remaining in hospital beds because a nursing home bed couldn't be found, part of that's workforce, part of that's staffing. But we're thinking, you know, it's probably time to take a deeper dive into that, to look at what are some of the underlying causes besides workforce that we can really work on to resolve the issue.
I think it's such a good point. One thing that we've seen on the hospital side is our length of stay has actually increased by a day at St. Mary's Hospital from 2019 to 2021. And really what that means is fewer admissions to the hospital, but higher patient census overall, putting greater demands on the already stretched staffing and support structure. So we really need to figure out a way that we can think outside our hospital walls with preventative care, chronic disease management, and then also figuring out ways after we discharge patients, trying to figure out ways to get those patients back to their homes with the appropriate support structure to help support them.
Yeah.
Has it gotten any better at a hospital level? I know at the height it was roughly 600 patients in hospital beds across the state weren't able to find direct care. Is it getting any better?
Yeah, at least from a St. Mary's Hospital standpoint, we are seeing that improve. We're seeing our length of stay come down, which is giving us more bed capacity for patients. But we're still seeing a lot of the healthcare system strapped right now with just not enough access to inpatient beds right now. So that is a factor that we're continuing to deal with, but it certainly has improved since the fall.
And I think, Naomi, that you know, one thing to think about, and one thing that the last surge of COVID taught us, is that backups in post-acute care, care that people need after they leave the hospital. If they become severe enough, they can back all the way up to the emergency department, with people in communities experiencing longer waits in the emergency department, longer waits for an inpatient bed, sometimes even having to transfer to a different hospital outside of their community. So we really need to work with our partners in long-term care, in hospitals and clinics to make sure that that continuum is open all the way across.
And we have seen our ER volume, at least at St. Mary's, come down over the last 45 days. Also in Baraboo at St. Clair Hospital in Baraboo, we're seeing some of the ER volume come back down to a little bit more manageable levels right now.
Excellent news. A bit of a dystopian question, if you will, coming next. Obviously, a lot of this is driven by aging workforce, aging population. Wisconsin is an older state. In your report, you mentioned we could lose more than 3,000 doctors by 2035. Now, granted, your report had a lot of suggestions about how to fix this, but if nothing changes, what's the worst case scenario 10, 20, 30 years in the future for Wisconsin?
I think, Wisconsin's population over the age of 75 is going to grow by 75%, and our population under the age of 18 is only going to grow by 3%. That's also dystopian. That means we've got a shrinking workforce. If we don't figure out ways within hospitals and health systems and healthcare to not only grow our workforce faster, but also to better utilize technology, utilize technology in a way that doesn't just improve patient outcomes and patient access, which is hugely important, but also take some work out of our workforce's hands. We are going to maybe experience the same type of backlogs or bottlenecks or pent-up demand that we experienced at the worst of the COVID surge in hospitalizations.
Now, I have to ask this question. Obviously, again, this report noted a number of ways to help alleviate the crisis,
Sure.
right? What about just paying more? Is that part of the solution here, is just paying more for some of these entry-level roles?
Sure. At the Wisconsin Hospital Association, we're in constant contact with our members, and we are seeing wages come up. People think about and should think about how much they make, but that's really a short-term, immediate solution. What people really hang on to their jobs for is the pay, but also the culture in their workplace, the exciting work or challenging work that they get to do. So we know within hospitals and health systems, yes, pay is going to go up as demand goes up, but we also have to take advantage of those longer term things that are attractive about a healthcare career.
I would just add, compensation is always a factor. We've got to figure out sustainable ways to make those compensation adjustments. As we all know, the healthcare system in the United States continues to face a situation where our populations are aging. That population is still consuming a lot of healthcare resources, and we're going to have to figure out a way that we can make the appropriate compensation changes, but also make a sustainable model that allows this healthcare system to continue to thrive for years to come.
Right. I would add to that even aside from attracting more people to the workforce, there's fewer people to attract. Healthcare and every other industry right now is feeling that shortage of just a shrinking pool of workers, and from our demographic trends, that's going to continue. So paying more is one piece of it, but if there's nobody joining your workforce, it doesn't matter what the pay is.
Kyle, Ann, thanks so much for coming on the show. Appreciate it.
Absolutely.
Thank you, Naomi.
Thank you.
When we come back, meet someone you'll be seeing a lot on the show in the future as we talk the latest in Wisconsin Republican attempts to discredit the 2020 election.